Hi everyone, and welcome to this next session of Kaplan's USMLE Step 2 CK Qblast. My name is Dr. Matt Alvin. I'm an incoming medical intern going into radiology, and I'm happy to be here with you today on our road to getting that higher score on test day. Let's get started. So you've got a 43-year-old woman with HIV, okay? That should jump out to you right there. HIV, anybody with HIV, a whole list of differentials could be why this patient's presenting. Comes to the doctor, why? Painful swallowing, odynophagia, substernal chest pain, weight loss for 1 month. Okay, she takes no meds, also a big thing, so she's not on the heart, the antiretroviral therapy. She's got a fever, also bad in somebody with HIV. And what's her CD4 count? Always a question you should ask when you're dealing with a patient with HIV. It's 41. Is that high? Is that low? You got to know the different levels here. What does it mean if it's lower than 50, lower than 100, lower than 250? What organisms could be causing anything that's going on here? That's stuff to learn and study for test day. Upper endoscopy shows inflammation and a large deep ulceration of the distal esophagus. A biopsy of this shows we've got some small blood vessel endothelial cells with what? Enlarged, smudgy, eosinophilic nuclei. What's the most likely cause of this patient's symptoms? So, is it acid reflux? Is it Candida, our typical fungus? Cytomegalovirus, herpes simplex or HSV, or herpes zoster? Take a few moments and select what you think is the best answer. Great. So the correct answer for this question is C, cytomegalovirus. So some key points. Infectious esophagitis, especially in these patients, occurs in people who are immunosuppressed. This person's got HIV, okay? They're immunosuppressed. That CD4 count really low. Less than 50, you should be thinking about CMV. That's a big thing. CD4 count less than 50, think about CMV. What do we see on endoscopy? Usually we perform this endoscopy with biopsy to identify what's the causative agent. Usually with infectious esophagitis, could be Candida, could be HSV, could be CMV. All these you could see in an HIV patient. However, the CD4 count should have helped give it away. When it's less than 50, you got to think that it's likely CMV. The description of those eosinophilic nuclei, the description of the ulcer, those are also things, as we'll see on the next slide, kind of helping to differentiate it. But last thing on this slide to definitely take away, how do we treat this patient? We treat CMV with Ganciclovir. Know that. So here we have a nice little table that differentiates our 3 most common causes of infectious esophagitis: Candida, HSV, CMV. Notice it's different types of appearances. White plaques for Candida. We've got multiple very small ulcers for HSV and 1 or more deep large ulcers like in this patient for CMV. And you know the morphology. We're talking about fungi for Candida, pseudohyphae. HSV versus CMV, a little bit harder. Both were dealing with intranuclear inclusion bodies, again, because CMV is basically a type of herpes, and they have different type of histologic changes. So, recap, what can we take away from this question? HIV patients who have CMV esophagitis, usually the key thing, CD4 count less than 50. CMV esophagitis, 1 or more large deep ulcers, eosinophilic intranuclear inclusions, not intracytoplasmic, intranuclear inclusions. Candida and HSV are other common causes of esophagitis, just to be aware of, helping to differentiate them from CMV. That's the biggest takeaway that you can do for this question to ensure you get any of these questions right on test day. Thanks for joining me here today for Kaplan's USMLE Step 2 CK Qblast. I'm Dr. Matt Alvin, and I'll see you next time on our road to get that higher score on test day.